All right. Welcome back to Regulating and Raising Podcasts. Today's conversation is for the mom who's been told that leaking, discomfort, or just feeling off in her body after babies is normal, but deep down knows it doesn't have to be that way. So I am joined by Dr. April Ritz, a pelvic and obstetric physical therapist and the founder of Effingham Pelvic Health and Wellness. She specializes in helping women, men, children with bladder, bowel, and pelvic health, as well as pregnancy, postpartum recovery, and birth preparation. So, as a mom of four herself, April brings such a real life, compassionate approach to this work, helping families really just understand what's actually going on in their bodies instead of just like brushing symptoms off. So, this is going to be really eye opening conversation around pelvic health, gut health, and what is actually looks like to support your body in this season. So, April, welcome to the podcast. I'm so happy you're here.
Thanks, Mackenzie, for having me. I'm really excited to share this information with moms.
I love it. All right, to start off with, I love for my audience just to get to know you on a more personal level. So, tell us a little bit about like how you got to where you are today because I feel like pelvic health isn't something that's super talked about. And then also tell us about you on a more like personal level, where you're from, kids, all of that good stuff.
Yes. So I am a physical therapist. I have my doctorate in physical therapy. And I honestly didn't even know about pelvic and obstetric rehab until I was in grad school. Didn't even know it was a specialty. I was an athlete throughout junior high, high school. And I was like, I am going to work with athletes. That's my passion for physical therapy. And then I went to a conference and was exposed to pelvic rehab and learned, well, I actually heard a lot of women in the bathroom talking about how much it helped them too personally. And I was like, okay, I want babies someday. Like personally, kind of selfishly, like I'm going to need this myself. And I knew at Effingham at that point, there was only one other pelvic floor rehab therapist. And so I was like, I'm going to bring this back. I wanted to start a program at a hospital, which I did. And then I just opened my own clinic. It's been 5 years. This fall will be. And so now I have a team of providers and we treat primarily women, but we also do treat men with prostate issues and children with constipation, bedwetting, things like that. But we have a membership at our clinic for pregnancy and postpartum moms because all moms need rehab. Even if they think they're doing well, their rib cage is off, their core is off, their pelvic floor has been affected, especially postpartum. You either had your body went through trauma, whether it was a C-section or a vaginal delivery. Both of those really affect our muscles. So yes, I'm super passionate about pelvic health and pregnancy and postpartum. And I love actually one of my favorite populations outside of like chronic pelvic pain and really complex patients is pregnancy and postpartum world. And then personal level, I am married to my high school sweetheart. We've been married, it'll be 10 years. We have 4 kids. My first one was an unplanned C-section. I was not obstetric trained at that point. Looking back, there was a lot of things I learned, and I say it was a God thing that he gave me an unplanned C-section. And then I had a hospital VBAC, and I had 2 home births that were like physiologic births that were beautiful. So we work with moms throughout the span, whether they're wanting a repeat section or whether they're wanting that physiologic home birth. We love working with all moms, no matter what they choose. Um, and then, yeah, so my kids now are 7, 5, 3, and I have almost 1-year-old. And I personally have experienced pelvic rehab myself. I've needed it with all my kids. So.
I love that you've, had your own life experiences as well. I'm so excited to dive in. So my first question that I want to talk about is I think so many moms have been told that things like the leaking, the pain, or even like constipation after having kids is just normal. And obviously we know that that is not the truth. So at what point should a woman actually like stop accepting that and start like seeing it as a sign that her body needs support?
Honestly, before we even get to that point, ideally. So if it's a postpartum mom, we want them coming in at 2 weeks. And at that point, you are still going to likely have some urinary incontinence issues going on after having a baby. But we think all women need to be seen postpartum to work on so many aspects of care, even if they feel great. But if a mom is having symptoms and you're realizing this is affecting your quality of life, it's time to do rehab. With that being said, though, the mom has to be in the right mental state and have the support at home. Because I actually was doing life coaching this morning in a session. A mom came in and was like, April, I know I need to be doing this stuff, but I go home and I can't bring myself to do any of it.
Hmm.
And I was like, okay, you're paying to come in here. You know you need to be in here, but maybe your why isn't strong enough. Because moms were always like, we got to get the next things done. We got to get the kitchen clean. We got to do the laundry. We got to do the shopping. And moms often put everybody else before themselves. And that's exactly what she was doing. And I said, I can't want this for you more than you want it. But then I also had the conversation. Sometimes we're seeing in moms and they're not aware of it. Is there any postpartum anxiety or depression that has popped up after having babies that we need to address? Because that can be a huge culprit of why we're not doing anything. Like we feel it. I had a patient a couple weeks ago. World feels like it's crumbling down on top of me. I just can't manage doing exercises. It's okay. This is not for you right now. We've got to get your mental health taken care of. So I'm like, let's talk to your provider and see what we can do for that. And then once you're feeling better and you don't feel like you're crumbling and like there's not an elephant sitting on your chest, then we could come back. I'll call you and let's see where we're at if you're ready to do some rehab. So I always tell moms, if you're having symptoms, the time is now to address it. But you have to be ready too. Physical therapy and pelvic rehab is not a pill. We're not about a quick fix. This is takes commitment. We need consistency, and if we don't have that, it's going to take a lot longer to make the progress that moms need. So,
What's the average, that you see patients who are, like, postpartum?
like length of care,
Yeah.
it depends. So we have, like I said, we like to get most moms in at 2 weeks.
Mhm.
Those moms aren't coming into us at 2 weeks, though, typically, unless they were a patient of ours during pregnancy and they realize the importance of that. Most moms, if they haven't even heard of pelvic rehab, they're not coming to us typically until 4, 6 months later, sometimes even a year, because often they're told it's normal, it'll get better, just give it some more time until it doesn't get better, and then it's gone on. So we always, like in my postpartum class, I tell women if you're still experiencing urinary leakage at 3 months, I think it's like 90 to 95% likely you're going to have that at a year.
Mhm.
So I tell moms that 6 to 8 week period, if you're having urinary leakage issues, you need to call and get in right away. Um, and then we see some moms, I see a lot of perimenopause, menopause women, and this really wasn't offered 20, 30 years ago. So we have some moms, 40s, 50s coming in, and they're like, I've been having low back pain, hip pain, pain with sex or urinary leakage or even bowel smearing now.
Mhm.
Um, and some of these issues started after having kids and they haven't addressed it in 20 to 30 years. And I always say it's never too late. It's not too late, but it is easier to address the symptoms right away than waiting that long. So like my mom this morning who told me, she's like, I just don't know why I can't do this. I said, listen, based on your labor and delivery experience, you are going to be the mom that's going to be likely when you go into menopause and lose that estrogen. You're going to be one of the moms that come in and I'm starting to see more fecal leakage and smearing. I've had a lot of moms with third and fourth degree tears that were like, I was fine in my 20s and 30s. I wasn't having bowel leakage. But then they
Yeah.
hit menopause and they lose that estrogen, and then the muscles get weaker too. And there's a combination of everything. And now they're having the bowel smearing. So if we can address that, rehab the muscles right away, it's going to be better than waiting.
Yeah, I mean, it's just building up, and the more that you wait, the harder, longer it's going to take to heal.
Yeah. And we haven't even talked about like hip strength. With pregnancy, our hips often get really weak, especially our rotators and our SI joint, which is in our C. There's often shifts that happen there in the pelvis, and we check that on all of our women. And if we can get you adjusted postpartum and then get you stronger to keep everything in balance, that's great. Some of the women I'm seeing, like I said, in the 40s and 50s, are like, I've had this pain. I checked their pelvic alignment. I'm like, you've probably been off alignment for 20 to 30 years since having those babies, because it's very common with our ligaments and everything relaxing in our pelvis to allow things to expand for baby. It's very common to get some instability there.
Is there any way for the mom who's pregnant right now to, like, build up the strength of those ligaments, so that it's not so hard to, once the baby comes?
So, not the ligaments in particular. The
Okay.
ligaments are going to stretch. We can't do anything about that.
Okay.
The muscles, though, the muscles give us the support.
Right.
So often, if we're getting low back pain or hip pain,
Mhm.
it's normally a muscular issue. There's a weakness somewhere that's not stabilizing. So a lot of these women I'm seeing left versus right, one side's weaker than the other.
Mhm.
So we're focusing more on hip strengthening in specific directions. I have women that say, well, I go to the gym. Okay, great. I'm glad you go to the gym. That's really important. We need to be doing exercise, even
Mhm.
preconception.
Mhm.
But if you're just going to the gym and always doing squats or always walking or doing hamstring curls, whatever, you don't actually, unless you've been assessed by a physical therapist, you don't know where your differences are left versus right and what muscle groups you really need to be targeting.
Yeah.
So yesterday, a postpartum mom who's actually a physical therapist came in. She's like, I'm doing great. And I was like, let me check your hips again. And she was still off. And I'm like, have you been doing your hip rotating exercises? And she's like, no. And I'm like, you've been going to the gym. I'm like, "Have you only been doing your squats and, like, heavy lifting and all that?" She's like, "Yeah." I'm like, "You can't forget about the small hip rotators. We have to get some hip rotation." So even when people think they're doing great, even physical therapists,
Yeah.
it's like, "We got it." You need an individualized assessment. You need to be targeting the specific muscles that your body needs. You really need individualized care, and
Oh,
then once you're, like, approved and you're doing great, and I say, like, "Okay, yes, you're up to this level of core exercise," then you can transition to some of those at-home programs. But a lot of core exercises for women postpartum are too high level and can actually make things worse, like diastasis rectus, umbilical hernias, pelvic organ prolapse, low back pain. So that's where like the individualized care, yeah, really comes in.
I feel like the individualized care and just in general is becoming, like, more prominent, like, people are, like, starting to realize, like, you can't just, like, put a lump sum of people into these, care plans any longer, and I hope, like, that's what my hope with this podcast is, bringing awareness that, like, we are not all built the same way. We do not have the same bodies. We have not been through the same, you know, upbringings, all of the assortment. So that is why, like, I love your work because it is so, like, individualized and, like, you don't just go in and say, like, these are all of the movements that you
Exercises,
should be
yeah.
doing, like, you're like, I remember, like, whenever we first met, you're like, "I have, like, a hour-long, consultation with my patients just to understand, like, their lifestyle, their history, and then I bring to the table, a care plan that I think would match best with them."
Yeah, so we do all of our treatments are 1 hour in length, and our initial evaluation for patients is 2 hours because we want to get to the full history. Like I always tell women, your low back pain, your thoracic tension, your upper trap, your TMJ pain. So TMJ and pelvic floor is
Yes,
connected. All of that is
I've read
connected.
that.
Your nervous system's connected. Your diet, your stress, how your like stress is, how your marriage is, all of that plays a huge role, and we want to get into all of that and really see how you're functioning. Um, yeah, it's yeah, so intertwined, and that's why I'm like when I open my own practice, I'm like we're doing 2 hour evals because patients need this, women need this, they need individualized care, they need to be listened to, they need to be told what they're experiencing is not normal, and just to brush it off and live with it. One of my pet peeves is um, I've had women told just for pain with sex, just drink a little bit wine, use some lubrication, just relax. And I'm like, okay, let's actually acknowledge that pain with sex exists and it can be like a musculoskeletal issue that can be helped and not just dismiss women.
Why is it so, like, common that because I feel like, a lot of, like, people in my network have experienced, like, sexual pain after having kids. Like, what exactly, like, happened and why is that?
Yeah. So, vaginal delivery or C-section, it
Okay.
really doesn't matter. You can still
Okay.
get pelvic floor dysfunction with both. Because if you think about it, you have all that extra weight pushing down on the pelvic floor muscles for 9 to 10 months. And your body, depending on how strong it is, how the hips, the core, the back, it braces, and that pelvic floor muscle sometimes tenses to try to withhold that pressure coming down. And the more babies we have, some of my patients get more pelvic heaviness with each child, where they get more of an achiness sensation. So during pregnancy, sometimes the muscles themselves want to brace and tense up and hold.
Mhm.
And then if you have any degree of pushing, or if you have that vaginal delivery, if you have a vaginal delivery, the pelvic floor muscles, they say stretch about 200%. No other muscle in our body is stretching 200%. And then if we take into consideration if there's any degree of tearing, that's
Mhm.
second, third, or fourth degree, that's into muscle. And then we have the scar tissue that comes from that, or any stitches. Was there a forceps delivery? Was it vacuum assisted? All of those things play a huge role. Um, and this afternoon, I had a patient, and she's doing pretty good. Um, but her complaint at this time is like they've returned to sex, and it was not comfortable. I
Yeah.
said, okay, let's talk about it. Um, and so yes, lubrication is very important, especially if you're breastfeeding. We just have more vaginal dryness. Um, so it's called the genitourinary symptoms of lactation. So
Okay.
just like menopause, there's the GSM or genitourinary symptoms of menopause. There
Mhm.
is now with the past year or two, they came out with this term where there's a change in the hormones from breastfeeding, and so we recommend vaginal estrogen cream too. So we need to do pelvic floor rehab to work on scar tissue, pelvic floor tension. And this is where a pet peeve of mine is birth prep classes telling all women to be doing kegels or kegels.
Mhm.
Not all women need to be strengthening their pelvic floor. A lot of women do not need to be doing that. They can actually increase tailbone pain, pain with sex, pelvic discomfort. So
Why
kegels are not
so?
because if we're tightening an already tight muscle, it's not gonna get any stronger, we're making a muscle more tense, so causing more pain.
Interesting. Okay.
So, in our clinic, honestly, I don't know, I might have had one patient today that I was doing, like, pelvic floor strengthening specific with, but a lot
Mhm.
of my patients are, breathing and, coordinating with their pelvic floor to get it to open up and let go of tension so we're not holding tight.
That makes
So I
sense.
say I say it's like if it's like your bicep here and
Yeah.
your biceps tight, we don't wanna just do bicep curls here. We wanna
Mhm.
fully lengthen it and then, like, get full range. Same thing with the pelvic floor. We need it to be able to fully relax and then strengthen and lift up all the way through that full range of motion. So, yeah, Kegels are not for everybody. So if you guys have one takeaway and you're having pelvic pain or,
Yeah.
like, endometriosis, PCOS, interstitial cystitis, pain with sex, tailbone pain, those are all things that I would say immediately stop doing Kegels if you're doing them, and find a pelvic floor physical therapist in your area that knows what they're doing. So,
Can you I feel like we need to, like, take a, like, couple steps back, because, after you and I met, like, I honestly didn't even really know what pelvic health was, and, like, what it all encompasses, and now I just, like, love it, and I wanna tell the world about it, especially because, she is doing a training this fall on what you do wanna talk about that? Like, what that really entails about your,
the
um
fertility
Yeah,
training? Okay,
yeah.
yes. Like, I'm doing a couple things this fall. So, yes, this fall, I think I'll be like I think it's the second, maybe the first, I don't remember, pelvic floor physical therapist in Illinois, like, certified in fertility care. So I currently teach a menstrual cycle, our fifth vital sign class for moms and daughters, as well as every once in a while I'll offer it for adults because most women just don't know their body very well. And a lot of symptoms women are experiencing, whether it's like dysmenorrhea or pain with periods, abdominal pain, low back pain, pelvic floor physical therapy is like first line treatment for that and not birth control. Okay.
Mhm,
And birth control actually can cause pelvic pain to be worse. There's fertility issues that can come with being on birth control. So, um, I just feel like women need to be completely informed before they make the decision to go on birth control. But the training this fall is working with women that are dealing with fertility issues and period issues. So I am really excited about that. I'm already doing a little bit of the work for that in the clinic, but I'll be able to like come back with so much more information on how to help women that are dealing with infertility, women who are not ovulating, PCOS, endo, all those types of things, as well as women that are in perimenopause, menopause, and considering like hysterectomies and these big like life changing decisions and helping kind of guide them through like what are your options if you don't want to jump straight into. I feel like a lot of women are just told, yeah, do a hysterectomy. And it's like, That's a big decision. We fully discussed that and decided if that's what's best for you. And have you tried all the things that you want to try before going into a surgery?
Love, love, love that, obviously, because my background's in fertility as well. Like, whenever April told me that, I was like, "This is amazing." So I can't wait to hear how that goes.
I do wanna
And
share
just
one more thing, Mackenzie, on that
yeah,
too, because when we talked, I just thought about is, like, most women, if they knew their periods better and knew what was going on, they wouldn't have to be like, they're just like the, unexplained infertility, you know?
yep.
Um, I just wish more women knew that there was other options before going to, like, IVF. So we teach, like, cycle tracking in the clinic and, like, Creighton model, cervical mucus. I will sometimes hook up women up with an actual instructor in our area who does Creighton, but then there's providers
What is
called, like,
Creighton?
Creighton model is like a form of natural family planning.
Okay,
So it is based all off of cervical mucus observation.
that's
And
right.
then there's some that are like more basal body temperature, things like that.
Okay,
And then there's doctors. We have some great ones in St. Louis who do, it's called NAPRO technology, natural procreative technology. And I've actually worked with one
fascinating.
of them, but their success rates, I have a handout on it, are so much better than IVF and it's natural. And with IVF, there's so many risks associated with that. The pregnancy is more like, yeah, we could talk a whole podcast on that.
Yes, we can.
Um, yeah, so yeah, be on the lookout. If you're having fertility issues, feel free to reach out to our clinic. I'll start taking a lot more clients for that later this year. But I am really excited to help women with this because women are spending so much money, and I'm like, oh, you guys, if we just could, yeah, not have to do that.
Yeah, at least, like, I yeah, yep, let's just not do that. Okay, so, you said, like, birth control can actually, um, irritate the pelvic floor. Tell me a little bit about, like, why that is.
Yeah, that is a great question. So, it's not all of them.
Right.
So if we're gonna get into specifics, what IUDs, I don't even know if there's actually research on this, but I have seen it so many times in the clinic where women was fine, pain-free sex, had an IUD, and then all of a sudden they're having pelvic pain and tension. The only thing I can really think of with that is there's this foreign object being inserted, and our pelvic floor muscles are like, "I don't like this in here." And then so our muscles tense up and guard around it, and I've had women that have got them removed and the pain goes away. So I'm always asking, like, "Do you have an IUD? Was that inserted?" Because I don't wanna, like, jump straight first visit and be like, "Hey, I think it's your IUD," because it might not be. It could be pelvic floor tension, there could be a lot of other factors. But I have had a few women that have gotten those removed, and they're like, "Oh, that is so much better." And now I'm like, "Okay, now let's work on releasing those muscles a little bit more since they were holding tense because of that pain from the IUD, then we now have to work on the muscles." So I say if there's, like, any trauma in any body part, our muscles around it guard and protect it, and so then we need to release those. And then, some birth controls, research has shown this, can cause issues such as, like, vulvodynia. Dynia is pain, vulva is, like, the vulvar region.
Yeah.
So we can sometimes get a condition called, vulvodynia or vestibulodynia, where the vulva and the vestibular tissue, which is, like, right inside the labia,
Mhm.
can get really irritated and painful, and then that makes, sex painful. Sometimes even tight clothing can become painful too. So yeah, that is a side effect of some birth controls.
Okay, so interesting. Okay, so can you just give because like I said, like I had not really heard of pelvic health until I met you, like your quick spiel of like what pelvic health is and like where can it assist like women you kind of mentioned men and kids but like just kind of give like a quick synopsis of that.
Yes. So pelvic floor physical therapy is physical therapy. It is hands-on musculoskeletal treatment based off exercises, breath work, calming the nervous system. And we help for urinary issues, bowel issues, abdominal pain, back pain, hip pain, pelvic pain. You come into the clinic. It's not a quick fix. It is a 2-hour initial evaluation, weekly 1-hour follow-ups. And see people, we write out their plan of care for a full year. We're not seeing them weekly for a full year, but we're doing hands-on exercises based on what we find at that first couple visits of what we need to be working on. A lot of it can be education around bladder bowel habits. People don't even know what's normal. Some of our patients are just coming in for pain with sex, and then we're discussing pelvic floor tension. We're talking about like what are good brands of lubrication because some ingredients we should not be putting down there.
Mhm.
We talk about positioning. There's our pelvic inlet and our pelvic outlet. So our pelvis has two holes to open, and so certain positions are better for some people. Um, yeah, so that's and then pregnancy postpartum, we do birth prep, we work on sciatic pain, we work on any dysfunction, really, like neck to pelvis, we address because if we're holding stress up in our upper traps, our pelvic floor is probably holding stress too. But yeah, I could keep talking. I'll leave it at that.
Hard question for you. Pelvic health, it can be very intimate for, women. I feel like that is probably a reasoning why women probably aren't coming in your door because they think that you just said like hands on, like you're not like physically putting like hands, like I guess kind of like tell us like
Nap.
what that looks like.
Yes. So, we always get patient consent. So the first visit, with it being 2 hours, if you are coming in for, pelvic floor specific issues, we do typically wanna do a pelvic exam. If you're okay with it. We have some patients who have a history of pelvic trauma,
Mhm.
and so we don't do that the first visit, and sometimes it takes us a month or 2 to get there, and that is fine. Some people can't even tolerate their abdomen being touched. So,
Interesting.
yeah, depending on, like, what level of trauma we're dealing with. So, we start with where we can. Um, if a patient is comfortable and they're an adult, we do not do this with pediatrics.
Mhm.
If they're comfortable, we will do an internal vaginal exam. We don't use a speculum. Your legs aren't pulled up and out. We keep it like our clinic is very homey. We want like you actually get like true real sheets. You're not on any plastic or like crumbly paper,
Paper.
that's going to stick to your butt.
Yeah.
Um, but we will do an internal vaginal exam. It's one digit insertion. We are looking at first the outside muscles. There's two layers of pelvic floor muscles. So we're palpating and pushing on those muscles and seeing if there's any areas that are like, oh, it's kind of tender. Should not
Mhm.
be tender at all.
Mhm.
And then we're doing the internal exam. And with that, we're looking at coordination. Can they squeeze? Can they relax? Can they do anything? Or is it just all tight and painful? Does it cause urinary urgency symptoms? Sometimes the pain can refer to the tailbone or to a deep butt pain or to a hip pain. It's all connected. And then based off that, we put together our program for the pelvic floor. But
Okay.
we're also looking at breathing. How do your ribs open? Because a lot of people don't breathe properly. That's the whole session in itself. We're looking at the core. Can the core fire? Can you engage your deep core? Are you just holding your breath and bearing down? There's a lot to it.
Wow. So how does that, because obviously like I'm a nervous system lover over here. How does this all relate to like why are you tapping into the nervous system in relation to the pelvic health?
Yeah, so there's been some studies done that show the relationship between the nervous system and the pelvic floor. So there was a study done that hooked up women to electrodes all throughout their body.
Mhm.
And then they showed these women like core images and like videos. And the first muscles to tighten up and contract on most women were their pelvic floor muscles.
Mhm.
And then I think second was their upper trap.
Mhm.
But we all know people like at work or in our lives, they're like, oh, yeah, man, my neck, I can't turn it. And so a lot of people do get tension up through here.
Mhm.
But even more women, when living in stress, pelvic floor is naturally going to tighten and tense and pull up to protect us.
Mhm.
And then, especially if we add on any history of sexual trauma,
Mhm.
that makes it, and sometimes women after that, their muscles just, and they don't want to let go. So yes, nervous system is huge. So for those patients, we don't even start at the pelvic floor. We start with breathing.
Mhm.
360 diaphragmatic breathing. Our ribs should be able to open out to the side, back and forward. It's not all upper chest breathing. It's not all belly breathing. We're getting our ribs to fully expand because that's our diaphragm. And our breathing diaphragm works with our pelvic floor diaphragm. So when we inhale, they both like lower together. When we exhale, they both lift up. And if they're we sometimes like this is so stuck on the pelvic floor and the diaphragm's just shallow. So if we can get it to fully open and drop down, then the pelvic floor can start to drop. So, yes, some of my patients I'm doing vagus nerve work on.
That's right.
We have to calm down the nervous system. And again, like I said, if the nervous system is upregulated, they're not gonna go home and do their exercises.
Mhm.
So we gotta get that calmed down first.
Yeah, I love it. I remember, like, after my 3rd kid, that, like, in the shower, like, after I had, just labored him, like, I would continuously do that because my uterus was so, stretched out and I could see it on the sides, and, like, that helped me tremendously. What's it called where your muscles are separated and
DRA or diastasis rectus abdominis.
that helped me tremendously heal that area.
Yes, that is our deep so I normally don't give, like, general exercise recommendations,
Right.
but deep breathing is one thing all women should be doing during pregnancy and postpartum. Yep.
Yep,
And then with
I agree.
DRA, learning how to engage the core with that too. So,
Yep. I
yep.
was like, I haven't done like a sit up. I haven't done and like I will say like I do have abs and like it's because of like breath work, like what
Mhm.
you can
Mhm.
do with it. Like it's a game changer. So I agree. Like starting there and your just postpartum journey is like crucial. I wanna talk about, constipation, IBS, like, I feel like those, like, is such a common thing that, like, I hear time and time again from, like, my own family, let alone, like, my girlfriends, like, what is normal, like, pooping schedule in your eyes
I would love daily.
daily?
Daily, once or twice. I don't really like ones we're getting up to, like, 3. If we're more than that, that's not normal, and I also don't like going every 3 days, okay? So, research really says normal can be every it can say 3 times a day to 3 times a week, okay? If you're going 3 times a week, you're constipated, okay? So, like a daily bowel movement, I love when people tell me like, "Oh, yeah, schedule, like every day 9 o'clock." Perfect, good. I do have a poop chart.
I
I
love
think
it.
it's at my desk. Yeah, I don't have it here. It's called the Bristol stool chart,
Mhm,
and it's type 1 to type 7, and type 1 is like little rabbit turds, type 7 is like liquid diarrhea.
mhm.
And then, like, there's a normal on that range, so I'm always asking my patients, "Where are you at on the scale?" If we have, like, little rabbit turds and you never feel fully empty, or if you're having to strain, if you have abdominal bloating, that is none of that is normal. You should be off the toilet within 5 to 10 minutes of having a bowel movement. You shouldn't be sitting there forever.
Don't bring your phone.
Don't bring your phone. Bad habit. Yep.
Yep.
And that's hard for moms.
Oh, yeah.
Because it's like their time to get away, and it's like, "I'm gonna scroll," and then I'm like, "Oh, your legs went numb? Yeah, you were sitting too long." Like, it
Mhm,
puts pressure on those nerves.
mhm.
Um, but yeah, so daily, I ideally a good type, like, 3, 4, or 5. I like type 4. I say it's like it's kinda summer's coming up, but, like, soft serve ice cream. Comes
Yeah,
out easy, soft, not, like, mini cracks in it. There should be absolutely no pain, but then on the other side of that, we shouldn't have diarrhea either.
mhm.
If you're having chronic diarrhea all the time, that's not normal either.
So what exactly is going on in the body for, like, latter of both of those?
Okay. Could be multiple things. There's multiple different types of constipation.
Okay.
So it could be functional constipation. It could be like slow transit where your gut is literally slowed down. So we do specific testing in the clinic to figure out what type of constipation they have. If they're not responding to the typical normal stuff that we give, we'll dive into it more.
Okay.
I had a patient that came in about a month ago with severe constipation, would maybe poop once a week, maybe twice. Um, I think it was all type number ones, a lot of abdominal pain, bloating, burping, and gas. Red flag went off immediately, and I was like, "Ooh, sounds like SIBO to me, small intestinal bacterial
Mhm,
overgrowth."
mhm,
And I cannot test that in the clinic, but with that is typically always some pelvic floor dysfunction and abdominal dysfunction
mhm,
because our body has been dealing with that pain where everything starts to tense up. So I work with a functional medicine provider, and she just came back positive for SIBO yesterday. So working with other providers, and then when it comes to like irritable bowel syndrome, technically what that is, if I remember right, diagnostic criteria is I think it has to go on for 6 months, but abdominal pain associated with changes in bowel, so either constipation or diarrhea or both.
mhm.
And typically with bowel movement, the pain is relieved. But yeah, bloating, abdominal pain, and then you're never like a good consistent number 4. So I do see that a lot in the clinic, and then we treat that, and I like to work. with a local dietitian who is specialized in like low FODMAP and IBS. And so we like to partner together.
Love that. And, like, just for the women who are listening, they're like, "Okay, I'm dealing with constipation or, IBS." Like, what exactly is happening? Like, constipation, like, your poop is seriously just, like, staying in your intestine, and what it's doing is, like, leaking out of your gut, getting in your bloodstream. Like, it is leaky gut and, like, contaminating your bloodstream. Like, and that is I mean, do you agree with that?
Yeah, yes. So, I always say if we're not pooping every day, that stool is sitting in your rectum or somewhere, and the water is being absorbed from it, and so it's getting even more dry. And then our gut helps process and metabolize our hormones too.
Yes.
So, if we are constipated, our hormones and like estrogen are not being um, like, emptied out of our body like they should every day, so then
Mhm.
we have more hormone issues as well. So, yeah, it's our gut is so important, and there's a lot more coming out on gut health,
Oh,
but yes, our gut is so important, and if we're not having regular bowel movements, that can impact our hormone synthesis, like, so many things.
yeah, I
Our
mean, your gut is your
serotonin.
second brain as well.
Yeah,
Like, I mean, it's
yes.
gonna mess up brain fog, anxiety, depression. Like, if you don't get this situated, like, it starts to shut down everything else. So that's why, like, I'm such a big proponent. As far as, like, IBS, like, it's the opposite. Like, you're just, like, depleting all your minerals that you have. Like, so, like, that is just as important to get it figured out by a professional and to get the support that you need. I
Yeah.
know my network, like, everybody is dealing with this, and, like, I'm like, I just want to cure everybody.
Yeah, and that's the thing too, that people have to be ready to get the help,
Yeah.
but normally people get to a point and they're like, "I can't deal with this anymore." But the big thing is people realizing it is not normal. Like, just because
Yes.
you were constipated as a kid and you're still constipated as an adult doesn't make it normal for you. It's still not normal. It can
Nope,
still
it
get
shouldn't be
better.
painful, it should be easy, actually, I love pooping, it's like the highlight of my day, like, I think it feels good, like, you know what I mean? Like, that's the experience that I want everybody to have. So, I appreciate you so much, April. Like I said, like, I could pick your brain for days. You are so knowledgeable, and she's put the work in, and she's so passionate, and, like, I just love everything that she talks about. So, if anyone listening wants your assistance, like, how do they find you? What resources do you have available? Share with us.
Yes, great question. So, we are not your typical hospital-based program. We are an outpatient clinic. You do not need a referral to see us, so you don't have to mess with going to your PCP or your GI doctor to get in to see us. Just give us a call, and we will get you scheduled. It may not be with me, but we have a team of providers here, and they're all great. I would not have hired them if I didn't believe so. Um, but yes, 2-hour eval, 1-hour follow-ups, just give us a call. Follow us if you're like, I'm not sure about this." Follow us on social media. We're on Facebook and Instagram at Effingham Pelvic PT. We also have a YouTube channel, same thing, Effingham Pelvic PT. Check out our website, effinghampelvichealth.com. And then, yeah, just call our office and we can always explain more information if you have any questions.
She's so good about also, like, wrapping her arms around the community and giving free, services and, education sermons. So definitely follow their Facebook page so that you can track her down and pick her brain. So I appreciate you so much, April, and we will talk to you soon.
Thanks, Mackenzie.